We are live.
Okay.
Good evening, everyone. It's uh, it's a pleasure to invite all of you again to yet another Gyan Pravah podcast series that we are having today. And this is episode 111. And it's been a wonderful initiative by our president, Dr. Sunita Tandulwadkar ma'am. And we have done it every day on every or at 8 p.m. onwards. And this has been, quite a, I'd say, quite a remarkable event of this year because every day, ma'am has been on screen for these programs, for like, as of now, for this last 5 months. Today, because of some schedule, she could not join us, but she has, of course, Dr. Ashwini Kale, who is the Joint Secretary of Fogsi, has joined us. And we will not be wrong in saying that Ashwini is currently the right hand as well as the left hand of Sunita ma'am. And she has very appropriately nominated Ashwini to join us. Ashwini herself, in her personal capacity, is an excellent embryologist. She is executive committee member of ISAR Embryology, and she is also the head of embryology in the Asha Kiran Hospital in Pune as well. So, Ashwini, it's such a pleasure to have you with us here. I request you to kindly say a few words of introduction. The topic for today is Green the Red Sustainable Menstruation.
Thank you so much, Priyankur, for the wonderful introduction and welcome, Rajasi Madam. So, basically, Foxy is an organization of 46,000 gynecologists across India. And we have been working under the leadership of Dr. Sunita Tandulwadkar since the month of January. Now, we'd be working for 1 year. So, we are also running huge projects. We have just initiated a project for menstrual health because that is also one of the programs on the list of WHO, UNICEF, UNFPA also. And of the many programs, another concerning program for us is Sampurna, which is the preconception care, where we're going to optimize the woman's BMI, her hemoglobin, her blood pressure, her hormonal levels before she gets pregnant. So we are having a huge launch and we are just collaborated with UNICEF and UNFPA to run these programs. And our another wonderful initiative is Know Your Number, where we are collecting key parameters for women above the age of 12 years. The important key parameters are the hemoglobin, the blood pressure level, and the sugars. So these are all the initiatives that Foxy is running through, and we are very happy that we could have a guest like you to talk about menstruation. I know today now the world is moving towards sustainability. And to tell you, Foxy has also instituted a new committee this year, which is the Environmental Committee, which is also working very hard towards all these goals. And we'll be celebrating on 5th of June, the World Environment Day. So once again, welcome and wishing you all the best for your podcast. So I'll join in from the viewers link, Priyankur. Thank you once
Thank you
again.
so much, Ashwini. Thank you for joining us. It's again such a pleasure to have you with us, Ashwini. Thank you so much for being here, and thanks for introducing
Thank
ma'am. Thanks for talking about ma'am and this whole series of events that we have done so well and under the leadership of Sunita Tandulwadkar ma'am. Thank you so much once again.
you.
Thank you. So now, as I said, the topic for today is Green the Red, Sustainable Menstruation. And to discuss this, we have with us none other than Dr. Rajashi Kulkarni Diwakar ma'am. She is an expert in menstrual health and sexuality educator and an activist since the last 11 years. She is a postgraduate in human development studies and learned development psychology as well. She was also into early childhood education in past and have experience of working with health workers, especially ASHAs, ANMs, etc. She has been with Anganwadi workers and school teachers as well. And she has reached, and this is a commendable achievement, ma'am, that she has reached 2 lakh plus people till date through various government consultations, NGOs, as well as awareness workshops. Ma'am, it's a privilege to have you with us, and we really want to listen to you, to your solutions of the various aspects of sustainable menstruation.
Thank you so much, Dr. Priyankur and Dr.
Ashwini.
Ashwini for this. I just want to clarify, sorry, I am not a medical professional. So a lot of times people assume that I could be a doctor because I work on this, but just wanted to clarify that. Yeah.
Perfect. I think your name, which is on the screen, Miss Rajasi Kulkarni
Yeah.
Diwakar,
Yeah.
clarifies that as well. So thank you so much, ma'am, for
Yeah.
doing that. And yes, the topic quite apt because you worked so much on this, and it would be very nice, for us to get. And since this is an, it's a menstruation awareness month, so we are looking forward. That's why on this topic this month, and we could not get someone more appropriate than you for this month because we wanted to listen to you on this topic. So, ma'am, to start off with, I would just like to introduce, you to the audience and the audience to you. So, I would request you with the first question about your journey. So, I would like to know from you, about your journey as an environmentalist and what drew you towards the menstrual health and sustainability.
Sure. Thank you so much for having me. And thank you, Foxy, for inviting me for such a nice event. So, actually, my journey started in 2013. I was doing a 1 year fellowship at a tribal residential school in Chhattisgarh. So, it was a very remote location where I was. And I realized that, no one was speaking about this topic at that time. And and sustainability part came into picture because I realized that whatever waste I was generating as an individual, like be it the packaging that came in with food or anything. And so I used to ask, like, what to do with this. So very conveniently from our homes our waste gets picked in urban areas, but then there was no one. So our one of our school, I will say, non-teaching staff, she used to collect it from everyone, and then she used to burn it. And then I realized that this is not a sustainable solution. And when it came to pad, we had to actually put kerosene because they would
Oh,
not burn. So, like, you cannot directly burn them properly. And there was a tussle with villagers and all those things because there were farmlands, closer to the school where we lived. So all those things that led me to think of this, like, about our what are our habits, what are our practices. And that is how I started to explore these options. And at that time I knew only about cloth pads, so I started so I started with that. And then it was very easy for me to switch to cloth pads because I will say that in my early days or early years of adolescence, I have used cloth and I was very comfortable using it. So I was very okay with the fact. And then I got introduced to menstrual cups, and then I became part of a community where so Green the Red is actually a community, and many more other communities are there that work on this topic. So that is how this works
has been started.
kept going. Yeah.
Great. So you talked about, ma'am, about like the topic that you give us today is green the red. Do you want to highlight a little more about? You already told us about the what do you mean by it? Like, the environment should be like more, like, it should not be any damage to the environment. Plus, the things that we dispose should be disposed well, etc. But could you be like, in little more in detail? Could you tell us what exactly went through your mind when you put this or tag this line of green the red?
Yeah, so actually we came up with this term as a collective. So what happened is, I will say, a couple of women who were trying to, find solutions for their, menstrual options. So that is how we came together, and we were, we were liking what we were using, and we wanted to tell this to everyone. So that is how earlier we used to call ourselves as cupsperts, because we were expert in talking about cups. So there were some doctors also, they are also, some gynecologists are also part of our team. So um so that is how this came into the picture, because we wanted to give it a name. And as you rightly mentioned, so disposal, actually, this is there is so much gray area in all this, like what I have learned over the years. It's not really black and white when it comes to sustainability also. And we also actually cannot, what we can say, force anyone into, having using X product or Y product. So, as you said, we still need, better disposal mechanisms. We need better systems in place. So, yeah. So, of course, the goal is to, that everyone should switch, but it's still a very long journey.
Difficult,
Yeah.
and it's a little a long journey that you're enduring and you're continuing. Absolutely,
Yeah.
ma'am. Thank you so much. So, ma'am, of course, now that you have talked about, you've given us a brief about the menstrual, the products, etc. So, we would like to know a little bit more about what is your, I'm sure you have worked a lot on it. You know a few statistics and numbers as well. So, can you share some eye-opening statistics or facts about menstrual waste in India?
Yeah. So, actually, with menstrual waste, actually, what has happened is, for many years we have been using this quote that there was this some report that came in 2011 probably, that only 12% women across India are using disposable pads. So that was the statistics that everyone was using. Now comes in the National Family Health Survey, which it keeps updating frequently. So the recent report says that, like in urban areas, the ratio is the proportion is quite high. Like more than 60% are using. Like depending on state, it changes. So like 70-80%, people are adopting using disposable options. And in urban areas also, it's like now reaching 40%, 40%, or even increasing in some certain states where menstrual health programs have been implemented. So what happens is, whereas when we see that, okay, people are getting products, they are using it, we see all this. Okay. At the same time, what happens is there comes an environment angle here, is that so like a person who on an average they use 10 to 12 disposable pads. Okay, so if everyone is using these many, we are going to create waste which is like a billions of pads. Like if we say 356 sorry 355 million menstruating women, we are going to create pads in billions, like the waste I'm saying. So what is happening is, and sadly, sir, what is happening is, it's not just about waste generation. I mean, statistics is one part, but other part is, where are they going, where are they disposed. So actually that is major concern than the actual number of waste is what I feel. Yeah.
Absolutely agreed. I mean, I think absolutely as you said, ma'am. I think what is important in current days that where is it going? The most of it is
Hmm.
not going to any incinerator. So finally, it's going to get disposed probably through very long ways, but ultimately might get disposed into water bodies. Water bodies clogging finally into the sea, and we know what's the situation of the sea currently. It's very bad. So very well said, ma'am. I think you have given us the statistics, the numbers, which runs in billions, and that is not something that is ideal or that is good. So, ma'am, what eco-friendly alternatives? Now, this is what we want to know from you specifically because I'm sure you have worked a lot on it. You have worked on, you said cloth pads are good, menstrual cups. There are some panties that have now come in, which are like period panties or something that can be used. So, these are things that are there. But what about sustainability? What about long term? What are the things you feel would be good and would be advisable?
Surely, surely. So, as I mentioned earlier, this is quite complex topic when it comes to sustainable products, because what happened is people were using cloth. Now we switch them to sanitary pads. Okay, we
Correct.
told them that this is a better option.
Correct.
Now we are telling them that, okay,
Switch back.
this is laden with chemicals. This has issues regarding disposal. Now you switch to some other product.
Mm-hmm.
So, it's as a individual, like I will keep aside me as an educator, but me as an individual, I'll be baffled with, like what to do, what to use, and so like there are women who have said like, saving environment, is it just, is it just only my responsibility? Yeah, that's true what she's saying. It just makes sense. Like it's not just only her responsibility. So I get all these things and I understand the concerns. So at the same time, what we need to think when it comes to reusable options is, again, there is a range of products. So there are cloth pads, there are period panties, there are this menstrual cups, and I'm sure many more things will come. There is menstrual disc also, but menstrual disc and cup is very similar.
Similar.
So again, in that, there is no so this is something that I learned from my journey and from the wonderful people I met in this journey, that one size does not fit all. Like, even when it comes to products, like there could be someone who will be very comfortable with a cup, and there would be people who might not be comfortable with cup, and they might prefer something like period panty maybe. So we will have to give tailor-made solutions to people, depending on their needs and their comfort and convenience, because environment cannot be the only factor to determine what to use. So
Correct.
and we have and I want to say this, though we are talking about sustainability, but I just want to point this out. There are people with disabilities, there are people with the like someone who is going through some surgery, or someone is bedridden for a while, and they will still have their periods. So in such cases, we cannot force such people to always think of environment, and there we will have to make exceptions. But what I feel is, like, people who are able to do it, what they can do is, they can like, we as an educators, what we can do is, we can tell them that all these choices exist and how to use them. So when we tell them and give them this agency that they can choose from whatever is available, they can make better choices. And other point that comes in, sir, is that not just giving products or information about it, we will also have to create access, like they can keep buying later, like connecting them to the manufacturer, or like creating more information, like the popular brands now, you find it everywhere. But right now they are not these cups now you are now getting in medical. Like, I just saw cup in the medical below my
Correct.
building. So okay, that's a good start, but that's not possible everywhere. So access is one part, sir, and other part is hand holding. So, like, even if we created access, we will need, like, if the medical store guy just hands me a cup, he won't know how to use it or what to do with it. So in such case, we need guidance. We need people to handhold, and especially when it comes to things like menstrual cups, it's very much necessary, because people can need support for 3 to 6 months, because everyone has their own hesitations, they have fears. So all of those need to be addressed when when we are encouraging someone to make the switch. So it's also the responsibility of educators to guide them how to do it,
Perfect.
and not give one lecture and just move away. We will have to stay in touch, share our numbers with them, um, follow up, do check on them.
Basically become the
So yeah.
helpline for them, and then help them in
Yes, yes.
choosing, plus also in case if they are in trouble using it, we can obviously
Yes,
guide them.
yes. We do
Perfect,
get
ma'am.
phone calls from washrooms also, and I
Awesome.
really appreciate that, because they are making an effort.
Awesome. That's so well said. So, ma'am, I think your efforts, the efforts of educators to going towards a sustainable menstruation is going a long way. But again, we in India we know that there are people follow our our cricketers, film stars, etc. a lot, and then comes a movie like Padman, which says commercial pads are not bad, and that again goes pushes you back 20 steps,
Yeah,
where you
yeah.
have to again start from there and again explain. Okay, fine, whatever the movie is was an older movie, but now we have to think of the environment, etc. is something that we need to look at. So I think that is one of the barriers, because of course commercial paths, there are a lot of finances, a lot of sponsors, there are a lot of money in there. So obviously the advertisements a lot. But then for this cotton pads, of course, there are not too much of advertisements. The cost is less. So it's the educators, the doctors, the counselors, all pushing together, maybe trying to help into such a thing. So, ma'am, I
Right.
would like to ask you, from your experience, is there any psychological barrier that you have come across towards sustainable menstruation? And what advice would you like to give gynecologists in trying to break this myth in practice so that this can become a reality?
Sure, sure. So actually, we have compiled a list of, FAQs that generally come from people. So, like when it comes to not just cup, but anything that has to be inserted. So people talk about hymen, virginity, and all these things. So, I remember one of these doctors, like we were doing a session together. She actually drew a diagram and she was like, the hymen is here. And if it's so tiny, it's so minuscule, it won't bother you. So she was explaining that so well. And I mean, that is one part where people are concerned about it. Mostly mothers will ask this because they're concerned about their daughters, like they're like, will she face any issues when it comes to her marriage? And so yeah, so his societal, this fears will be there. So this is one part. Then again, then there are also psychological aspects, like as I told that, we told, the educators in past, or educators and everyone, I will say, the community who talked on menstruation, they said, now switch from cloth to disposable because it is a better solution. And now we are asking people again to go back to reusable options because disposable are not serving the purpose, or they are not very, they are not a better
Convenient,
thing.
etc.
So it confuses people. That is one thing. And they have got so used to the convenience of those disposable products, like uh, like people ask, like, I don't get time to wash my cloth pad or a period panty. I will not be able to use it. So I don't get time. And then actually I had asked certain women, like in one, there was this one session in corporate office, and she's like, I cannot use cup, but I also like there was some other issues. So she said that, I cannot use cup, I face issues. So now I want to try other things, but she was not okay with washing. So I actually gave her real examples, like how I manage my periods when I'm outside, and how I, actually come back and, wash my period panty or cloth pad. So I gave these real examples. Then I actually also had to ask people at times that, do you wash your underwear? And they're like, yes, we do. Of course, it's non-negotiable. We should wash it every day. So I said, yeah, just take 10 more minutes and wash, whatever, cloth pad or period panty you're using. It's going to just add 10 more minutes, nothing more than that. It's just part of a practice that, slowly it will take time. So these barriers come. And this kapada ganda hai is a very big barrier.
Got
So
it.
yeah, so it takes really long time to tell people. So in between, there was this whole movement that, only cups are best, and such things were coming on social media. They were very trending. However, I do not believe that. I believe it is, it is how you handle things.
What
And
fits you best is the best for you.
sorry.
What fits you best is the best for you is, I think, what
Yes,
should be
yes,
the
yes. And
solution.
sir, you won't believe there are doctors like gynecologists who have, become part of this movement. And they actually, make videos, or they explain it to patients that, if your cup is stuck or anything, you can always come up to us. We will help you,
It's a very
uh, use it properly. So yeah, support is getting, available
better
now.
and better. Great. That's
Yeah.
awesome, ma'am. Ma'am, this we have talked about the reproductive age group. We have talked about women who probably understands better and uses it. But what is your advice in adolescent girls? Because adolescent is a major bulk of our population. Uh, is it like, advisable? Number one. Number two, is it easy to advise these youngsters and their mothers such that this adolescent girls can also use sustainable products?
Yeah, yeah. So this is a very tricky subject actually. So, from my experience of talking with people, and also while talking with doctors and other experts, so they have generally said that, so since this is a new thing, be it tampon or cup, this is a new thing. So what we should do is like, as an expert, any capacity, like doctor or anything, what we can do, take a safe approach is tell the parents that these girls can use the cup when they are like comfortable with period, like not in the first period probably, like
Okay.
after a couple of cycles when it's regular and she's comfortable. And there are a lot of organizations, what they do is they say that probably try using it after you turn 15 or 16, because that also makes sense, because till then the girl has adjusted to the changes, and she is able to manage things on her own slowly, like when it comes to changing pads or changing product. So that is one approach, and till then they can use a cloth pad or a period panty. And in that case also they will need hand holding, because again it needs washing and all. And in these cases what they can also do is like, if there is that if that is available, they can either wash it hands, like if there is no other option available. But like cloth pads, period panties, I have seen that, like I've spoken to some mothers, so they said that they just ask their daughters to soak it in small bucket, let it soak for couple of hours or maybe half an hour. And what these mothers do is they will just squeeze the blood out of it, and they will put it in the washing machine with other clothes. I am aware that not everyone will be okay doing this, but we have also seen that girls take owning this up and doing it. With cups, it's very tricky, and we need hand holding. So for cups, what I recommend and many other people recommend is that the mother should be mother, or any whoever that person trusts, they should be educated about how to use it, how to uh, practice it and other things. So when they are knowing it, then the girl can comfortably use it, because she has someone to guide her if anything, she's facing an issue.
Correct.
So that is needed when it comes to adolescent. But there are also examples like people who are from bigger cities, where the girls brought cup themselves. They're using it, their mothers not knowing it, or their mothers are not users, but these girls are very comfortable using it, like from 13 or 14 years old. So there are such exceptions also, but we highly recommend that we keep the parents in loop, and then we do it.
Great. So, next, I would like to, you have briefed us very beautifully about the adolescent aspect of sustainable menstruation, ma'am. I would like to next ask you about postpartum women. So, of course, postpartum women, there are two major issues. Number one is the unpredictability, because bleeding can happen at any point of time. And how prepared do you want them to be, or what products they have to keep with themselves so that they can use it well? And the second part of the question would be in postpartum women, with of course the hygiene, because that is a major part so that infection doesn't happen. What is the one that is the most recommended?
Yeah, yeah. So, like I have spoken about this with some gynecs as well. A
Hmm.
friend, when she was expecting, so we actually met a doctor and we discussed this at length. So she very beautifully explained it to us that we ask people to not insert anything in their body in the postpartum time, like not even tampon or anything.
Hmm.
Like the she, like this, my friend was given like something very soft cotton gauze like thing to use
Okay.
for her postpartum bleeding.
Hmm.
And she told me even that that felt like it's too much. So
Okay.
in such case, like that is one thing that the doctor is going to provide you with that for
Hmm.
limited duration. But later it happens, the bleeding continues even if you have gone home. So what
Hmm.
happens is like, there is a complete no when it comes to tampon or menstrual cup, but
Hmm.
they can use period panties. There are some brands who make cloth pads specifically for postpartum, which are bigger in size, they are more absorbent. Even with period panty now, those options are getting available. So, if they want to try something sustainable, they can think of these options. There are brands available now.
Okay. Okay. Sounds good, ma'am. Thank you. Thank you for the update. Ma'am, next, of course, another topic is we have talked about counselors, we have talked about doctors, educators like you who educate people around, and the two very important words that we have heard throughout. Number one is counseling, and number two is handholding. So this were things that probably are going a long way in helping women into adopt into such practices. But again, we know that there has to be support from the big guns, the policymakers, the equity, etc. So, ma'am, is there any initiative currently from the government, NGO, or any organization, leading organization of the country who probably helps or who is leading the way towards the sustainable menstruation goal?
Yeah. So there are organizations, or I will say groups, that have been advocating for this reusable menstrual products for many years now. So, we have gone and when I say we, I will say as a community, I will say, which
Mm-hmm,
includes
mm-hmm.
doctors, practitioners,
Of
everyone.
course.
So we have gone to meet ministers, local politicians,
Mm-hmm,
or even the people in higher positions.
mm-hmm,
So what has happened is, over the years there has been some acceptance related to this. And
mm-hmm,
earlier, we when people used to like just say that, no, 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 this is not a solution, no, we will not
mm-hmm,
accept this. But
mm-hmm.
now we see that, like just recently, like I was in Nashik last week, where the the CEO of Zilla Parishad, she came
Mm-hmm.
up with this initiative of giving menstrual cups to ASHA workers and
Very
educating
nice,
them.
huh?
And now
Mm-hmm,
these ASHA workers will go and train other people, train or educate people on field. So there are such initiatives that's coming up now. Over the years, because of the lobbying and advocacy, the Bureau of Indian Standards, they came up with standards, like and it was open to everyone. We were we all could give suggestions to them. And finally last year we have standards for there is already standards for disposable, so they got revised. Now they
mm-hmm.
included period panty, they included cloth pads in it. And the standards for menstrual cups, they're still under process. I assume they could come by the end of this year,
Mm-hmm.
because a draft is in, it's in the
Yes.
process right now.
Mm-hmm.
So this is a very good step towards this, because if we get standards, it's going to get recognized, and people will be, able to make those products safe for everyone. So
Awesome.
that is also going to give assurance, because people ask that, what is the certification, or
Mm-hmm.
if there is any study or something. So I think such initiatives by government are helpful. And you will see, like like I mentioned, the initiative at Nashik, there are multiple such initiatives where the local administrations have collaborated with any some organization, and they have done these drives. So like they have done a project for maybe a couple of months or years
Great.
on
So I think
sustainable part. Yeah.
perfect. So I think what we are looking at is this local organization or local collaboration to become a bigger collaboration. And if it becomes something of a nationwide collaboration, that would be the best that's possible for the environment
Yeah.
per se. Great, ma'am. Ma'am, what is your vision for menstrual health and sustainability, especially taking into aspect the doctors, educators, and environmentalists collaboration, which could be, leading to something more effective? How do you see it? And as Ashwini was saying, Foxy is an organization of 46,000 plus gynecologists. So how do you foresee or how do you see something that, such an organization, such a strong organization could help in, in forwarding or in forwarding the environmental safety as per what India is concerned as of now?
Yeah, that's a very wonderful question, because we cannot work in isolation, and we need all hands that that are there. And when it comes from a doctor, it feels even more authentic, and it feels like it's trustworthy. Like,
Mm,
I, as a Rajasi, if I tell this, and
mm,
if it and the doctor says it, so
mm.
even if the doctor is not a gynec, but she has a doctor
Yes.
in her name, so people suddenly feel, oh, she could be saying right. Okay,
Mhm,
we
mhm,
should trust her. We should listen to her.
mhm,
So that is one part, that is psychological part.
mhm,
Other part is, sir, Green the Red, the community I mentioned. We began our work somewhere in 2016, early 2016, and
mhm,
in 2018, actually, we did a campaign that included doctors in that. It was called Green Doctrine. Okay, maybe if anyone wants to check, they can check the
mhm,
website greenthered.in, and it is mentioned there.
mhm,
So there, we brought together various doctors, because otherwise we were reaching other people, like not
mhm,
doctors, but like other, I will say, other players or other stakeholders. But this
mhm,
was specifically for doctors, and we had received really good response for that from multiple parts of India.
mhm,
So it's very important. And another thing, sir, that is important in all of this is, if we all have to join hands, we will, I mean, this is not something very, some rocket science that I'm sharing. Is like, we will all have to be very collaborative, because what happens is, people get defensive.
mhm,
People, like, I have seen this happening within community. Like, the doctors think they are best, the experts
mhm,
think, no, no, we go on field, so we know more. So
mhm.
it's not like that. We want to
That's
bridge
their
that
team
gap,
effort.
because as an educator, I don't really know the anatomy. Okay, I know
Mhm,
from whatever I've learned over the years, or some lectures I've attended, but I never learned anatomy for so many years. So I need a collaboration of doctor. I cannot
mhm,
work without that. So that is one part. And other
mhm,
part is, doctors also need support when it comes to communication, or I will say outreach, because doctors, if they're busy in the hospitals and taking care of patients, they are
mhm,
going to need local support to mobilize people, or even take follow-ups later.
mhm,
So we need to work together in this. And I'm sure there is so much to learn from each other.
mhm,
So we can definitely work in collaboration. And having a doctors is so important, I feel, because doctors have the knowledge of anatomy. They know what are the possibilities, all this, what I will say, sensitivities, or I will say
mhm,
that reactions that happen in the
mhm,
body when you're using x something. So I believe having their guidance, and them also being open to learning something like sustainability. It's like a win-win situation for everyone. So yeah. so
Sounds
uh,
good.
so if we are able to reach more and more doctors,
Correct.
and more gynecologists, I will say, it's not just going to help talk about sustainability, but I also believe that once you start talking about products like menstrual cup and all these things, it helps you, it helps other, I will say, uh, your beneficiary, or for the lack of right word, I will say, but the women you're working with, or
Mhm,
menstruating people you're working with, they are also going to feel confident in their body, and they are also going to get so many doubts answered.
mhm,
Because we have fears, like people feel like our body is some something magic, and this and that. And then people also think that the cup is going to end up in my stomach, and all of these. So we we need people who are expert in these, and they can explain it very well.
correct.
So yeah.
Perfect. That sounds good, ma'am. So I think collaboration, activity, bridging the gap between multiple organizations can go a long way in probably reaching out sooner. than what it should otherwise be. Now, thank you so much for briefing us so very well, ma'am, on this important topic. But before we end, we have three quick fire questions, which I definitely need to put forward to you. Number one would be one myth you wish every woman stopped believing.
Sorry, every woman.
One myth you wish every woman stopped believing.
I really wish people stop worrying about virginity.
Perfect. Okay. But do you feel that uh, women think about virginity more, and or is it more of a social stigma where women feel that virginity, or now that we're getting hymenoplasties, etc., done because of the fact that post marriage, they might be questioned.
Yeah, yeah, yeah.
That
So
is
yeah,
something.
I really hope that they get comfortable with their body, because
Absolutely
and this is again, sir, we are seeing this in urban areas also now. So not just rural areas. So as you rightly said, it is social stigma, but also we have kind of taken it on ourselves now.
perfect. Got it. Second, one product about sustainable menstruation which you swear by.
This is a very difficult question.
No, but this is because we have a lot of gynecologists here. Something that in one word you would like to say, which we could think towards, because when we give multiple options and when we ourselves are not sure of what the options would be, we will not be probably giving something that is appropriate. We also do understand that probably the only instrument we have is a hammer. Every tool looks like a nail, so that is not the scenario that we're looking at here. We definitely have a cafeteria approach where we can give them all the options, but one product which you would say might suit most of them, if not.
I would say period panty. It's like a mix of both.
Okay.
The Yeah,
So that is something that you feel would be the best. And is it quite
yeah, yeah.
easily available?
Yes, sir, it is getting quite available. And it's like, you don't need to use a cloth pad, and you also don't need to insert anything. So it's like, in between of both.
And do you then, dispose it off, or do you wash it?
No, you wash it, you reuse it.
You wash it. And what is the cost
Yeah.
of one panty probably?
So I think the cost starts from around 300 rupees. Again, depending on the material and absorbency, it might go little higher. Yeah.
And
But
the second, so
hmm,
yeah, also I would like to ask you, suppose in some situations we know on the second day or the first day some women bleed a lot. So do
yeah.
you advise them to keep a, panty in hand in the bag or something in case when they're traveling? Because if it gets soaked, what do they do? Because this is something that might come as a burden in this thing. They're using a panty and they've gone to the workplace and all of a sudden it's soaked and it's full, and
Yeah,
then
yeah.
what do they do with that? And they do change, of course, but what do they do with that which they were wearing?
Frankly speaking, sir, the cup has been something that has been advised, as the best product, but unfortunately, there is no best product.
Yes,
So, what products suits you well? That is the thing.
that
But
is
as you
amazing.
mentioned, period panty is something that can be used as a backup. Like even if you are expecting a period, you can wear and go outside. That's fine. And other thing is, like, if you're a heavy bleeder, like I'm also one of the persons who bleeds more. So what I do is I wear one more product with period panty and use period
Perfect.
panty as a backup. So
Backup.
be it a
Sounds
cup
good.
or a cloth pad. Yeah.
Sounds good. So I think this sounds quite good. I mean, it's probably a menstrual cup with a period panty. So that works well. And then once you come back home, you can remove the cup and you can have the period panty on,
Yeah.
and that's
Or even
actually
if you
something that is
feel
fine.
that you want to remove the cup and just continue with the panty, that's also fine. Yeah.
Perfect. Perfect. Got it, ma'am. And the last question would be your message to the gynecologist on the front of women's health. So what would be your message to them? How would you want them to, uh, advise the women who advise the clients who come to them, so that it becomes easier for you on the work front?
Um, this is very tough actually, but
Just a sentence, one line, you can finish it off, and whatever you want to say. I know it's difficult. I know you will have
yeah,
to
yeah,
probably tell a lot of things, but then in probably a short message that you want to give to the gynecologist, because we
yeah.
probably can, talk about the same thing to our women who come to us.
Sure, sure, sure. So, I will say that even if you get any setbacks when you talk about this, I'm sure you will get. but please talk about this, because we need this education. Everyone needs this education, and we don't know if people will switch or not, but it will make them comfortable about their bodies. And if you are talking, it's going to help us everyone to break taboos, and be more comfortable about ourselves and be more confident. So just one thing I want to add here. I know it's not related exactly,
Please
but
do.
I will. I have two fabulous gynecologists in my life right now, and I wouldn't have done without them, because they are patient listeners, and they have always guided me through that, through everything. So yeah, like having resourceful people who call spade a spade, and who also guide you wherever needed. I think it's a blessing.
Sure, ma'am. Thank you so much for your wonderful message. I think the one message for the gynecologist today, as you very well summarized, is keep trying, and at someday you will definitely succeed. Probably this is something that we are trying and we are trying and we will continue to try, but there will be failures, but we should not give up and we should continue trying and talk to the woman about the same
Yes,
thing over
yes.
and over again.
and
I think
reach out to people, like
yes.
we all will be happy to help.
Absolutely. So if there's anything, we'll definitely come back to you, ma'am. Thank you so much for your help always, and thank you so much for offering help to us as well whenever we require. And at some point of time, I hope there'll be another woman who will say that I have one gynecologist in my life who changed my life and who has helped me a lot, especially to maintain a menstrual life without any much of a problem or a proper solution, basically. So thank you, Rajshri ma'am, for once again for joining us. Thank you for giving us this beautiful insights. We will definitely be having this session uploaded for others to view at some point of time as well. I would share the link with you, and I wish that more people get to see this session, and so that some information disseminates to them and they start using it later on as well. Thank you
Thank
once
you
again,
so
ma'am.
much, sir.
It was a pleasure to talk to you, ma'am. Thank you so much once
Same
again.
here, same here.
Take care, ma'am. Thank you.
Thank you.
I'd like to thank Sunita ma'am once more for giving us this opportunity, and I'd like to thank Dr. Suvarna and the whole Foxy team for having the trust on us and having this discussion on this important topic. Thank you once again. Thank you, ma'am.
Thank you.